Kaweah is very dedicated to change, and they're not afraid of it, to increase the types of procedures that we can perform with a high degree of comfort and ease. TEVAR is performed here at the hospital in our cath lab. TEVAR is thoracic endovascular aortic repair, and it treats so many different types of diseases that patients can have, from traumatic injuries that happen if you get into a car accident, it tears the aorta, or aneurysms or dilations of blood vessels that get too large. It's an amazing, minimally invasive approach. You access the blood vessels from the groin where they're quite large. You insert a graft in a minimally invasive manner through the blood vessel, and then you deploy a stent graft. So it's a covered piece of metal to block off the areas of disease to allow a patient to have a normal blood vessel again. So TEVAR has been performed in the past by just using a C-arm, which is a portable fluoroscopy machine. However, fluoroscopy machines don't have a lot of clarity in terms of the imaging that they provide. A hybrid room is very much essential to the modern vascular surgeon. It pretty much goes hand in hand with our capabilities to treat such a complicated patient population. And the ability for the hybrid room to be able to move the patients around on a flat surface instead of moving the fluoroscopy allows me to control the image that I want for a much more precise procedure. And in the past, unfortunately, what had been happening was that these patients that needed this surgery were actually having to be shipped out of our county. So this way we can offer it for our own community right here in Visalia. For these TEVAR cases, we have both the operating room team as well as the cath lab team. We kind of work hand in hand to make sure that all services are available for our patients at a moment's notice. Sometimes patients come in an emergent sort of situation, and in that case, we are at the ready. Everybody is so committed to the patients that everybody always tries to do everything as quickly, efficiently, safely as possible. If patients are here for an elective TEVAR, we prepare them by checking their kidney function, and they just come in the morning of the procedure, have the procedure done, which takes about an hour or so, and then they'll stay in the hospital for another day or two at the most. After the procedure is done, they'll see us in the outpatient setting, and typically we'll get another CT scan just to make sure our repair was good. And then after that, we just see them routinely for follow-up.